Welcome back to Square Off. As predicted, the Omicron variant of COVID has slammed Arizona. It's not a wave, it's a hurricane. Just a few days into year 3 of the pandemic, Arizona is hitting record highs for COVID cases, emergency room occupancy, and ICU occupancy. The state's overall death rate is now tied for second highest in the country. Arizona's public health response under Governor Doug Ducey has been restrained. CDC guidance can be confusing. So how should you protect yourself and your family? We're getting answers to the most pressing questions from former Arizona Public Health Director Will Humble. He's now Executive Director of the Arizona Public Health Association. Welcome back to Square Off.
Good morning, thanks.
So let's start with the big picture. Compare, contrast the massive surge last January to what we're seeing this month.
Yeah, so I think we're actually in for a month in January of 2022, much like 2021 in terms of the case count. But I don't think it's going to translate into the same number of hospitalizations per case. And the reason for that is there are a lot more people in the high-risk category that are vaccinated now. On the other hand, this Omicron variant is extremely contagious. It's going to infect a lot of people very, very quickly. And the sheer number of infections that are going to happen in January and probably early February are going to result in a lot of new hospitalizations. And as you know, the hospitals in Arizona are already and have been really for some time at their capacity limits. And it's going to stay that way for, the foreseeable future. And one of the sad things about it is that a lot of folks that need non-emergency procedures like hip replacements, knee replacements, heart valves, slow-growing prostate surgery for cancer, and those sorts of things are going to have to be delayed probably into the spring.
So let's get to some specific questions. If I get sick with COVID, the Omicron variant, how long should I quarantine?
Well, so the CDC has some new guidance out, and I think while they rolled it out in a ham-handed way, it's decent guidance. What they're saying is that it depends on how symptomatic you are. So if you test positive and you're asymptomatic, CDC says that you need to quarantine, stay away from the public for 5 days. I suggest that you do a rapid test at the end of that. CDC isn't saying that. If you're symptomatic, then you should wait for your symptoms to go away. Give yourself 5 days of symptomatic-free living, and then I think you should do a rapid test to ensure that you're no longer transmissible before you go out into public.
Masking guidance has changed over the last year. Now it appears we're back to the use of N95 masks, the most protective masks. Cloth masks apparently don't get the job done. What should I wear and in what kind of situations?
Yeah. So as you know, there's two kinds of masks. There's the typical cloth mask that you see most of the time when you're out in public. Those are the type of masks that work well when everybody in the room is wearing them. That's why those cloth masks are good at stopping particles from leaving your mouth. So it prevents particles from getting into the room. And if everybody's wearing a mask, the air in the room stays a lot cleaner and there's a lot less chance of infection. But given the fact that we have no mask mandates in our state, the governor is actually hostile to those. We're in a situation where mask wearing is really sporadic if you go out in public. Therefore, it's important for persons who want to protect themselves, and I think they should, even if they're vaccinated, to wear an N95 or a KN95 or a KN94 mask and make sure they're tight fitting, because those are the type of masks that are much better at filtering air coming in. And because no matter where you go in Arizona, most likely most of the folks are not going to be wearing masks. You can still protect yourself with one of the higher quality N95 masks if it's tight fitting.
So there is new concern about more children getting sick. How dangerous is Omicron in kids?
Well, a lot of kids are getting infected. That's one of the things is, that this Omicron variant is extremely contagious. Kids are catching it at a really fast rate. And so we do see an influx of cases into the hospitals for kids. There is some indication that the Omicron variant provides more serious symptoms in kids. It provides less serious symptoms than adults. And we're fortunate for that because so darn many people are going to get infected with this variant in the next 6 weeks. We are certainly fortunate that it's less severe among adults, but potentially more severe among kids.
How severe?
Well, it depends on the kid.
We're talking about long-term.
I do encourage parents to get their kids vaccinated, but it is a very low risk if your kid gets infected with the virus, either with a breakthrough case or a case because they're unvaccinated. But so I don't want to scare people, but it's like it has been for the last 2.5 years with this thing. It's really rolling the dice. There's marathon runners that are in their 30s that end up dying for this thing, and other people who've been chronic smokers who are 60 who survive. So, that's what has been so unpredictable about this virus is the individual clinical outcomes.
Let's talk about schools. They're trying to ride this out. What kind of steps can schools take? Again, there are no mandates allowed, but what kind of steps can they take to protect teachers and protect children?
Yeah, there's about 5 things that schools can do, and I'll tick them off really quickly. Some of them they can't do because the governor won't let them. But the first thing is to require universal masking in the classroom. I'm not talking about outside on the playground, but universal masking in the classroom with good adherence. The second thing is, especially down here in the deserts, have your classroom lunchtime. Have your lunchtime outside. Probably can't do that in Flag, but most of the deserts you can have your lunch period on the outside so kids can eat without their masks. Schools can implement a pooled testing program or individual testing program with the rapid test, and then do good contact tracing to make sure that they're catching cases before they cascade and end up causing problems in the classroom and have classroom or even school outages. And then finally, what the governor the other thing they could do is add HEPA filters into the classroom. 2 HEPA filters running on high are really effective at clearing the air, even if the kids aren't wearing masks. So HEPA filters are effective. Schools could do that. And finally, Interim Director Harrington could add COVID-19 vaccine to the list of required immunizations for school attendance. I know he's not going to do that because he wants to keep his job, but that's a policy measure that could be implemented at the state level. It won't be.
That's DHS Director, Interim Director Dawn Harrington. And also, of course, get your shots. Adults
of course.
get the booster.
I should have left that, put that at the top.
It needs to be said, but
get your kid vaccinated as soon as you can, if you haven't already.
Last question. What is the longer term impact of Omicron when we look back 6 months from now?
Yeah, I think what we're in the process right now is compressing 6 months of 2022 infections into about 6 to 8 weeks. And it's because Omicron is so incredibly contagious. And so in the end, while January and February are going to be super challenging in terms of, families not being able to go to work, kids missing school, clinical outcomes, hospitals being crowded, lots of even deaths in the early part of 2022, Omicron is going to help this virus get to closer to herd immunity and really what we call in epidemiology endemic status much quicker than it would have if Delta had remained the dominant strain. So it's really compressing the infections into a much shorter period of time.
Will Humboldt, great advice as always. Thank you so much.
Thanks.